Did you know that COPD was the fourth leading cause of death in 2014? According to the American Lung Association in 2018, this disease is often overlooked. COPD is used to describe progressive lung diseases including emphysema, chronic bronchitis, and asthma, according to the COPD Foundation in 2018. Chronic obstructive pulmonary disease is composed of emphysema, chronic bronchitis, and asthma. It is progressive and it is non-reversible. So asthma is caused by environmental factors including allergens, pollen, or pet hair, cold hair, and it is genetic. And if you have asthma, you have a higher risk of developing COPD. COPD is a silent killer in America. Approximately 12 million adults in the U.S. are diagnosed with it, and 120,000 die from it each year, according to the U.S. Department of Health and Human Services in 2018. Emphysema damages the tiny air sacs that are in your lung, leaving large holes in the lung which trap stale air. People with emphysema can have great trouble exhaling. Chronic bronchitis is inflammation of the bronchial tubes. It carries air to your lungs and makes it difficult for you by coughing and all of the mucus that is caught up in there. It consists of shortness of breath, wheezing, and chest tightness. So, secondly, according to Healthline in 2017, 90% of COPD deaths are caused by smoking. So the biggest risk factors associated with COPD is smoking, someone over the age of 40 being on the low side of it, exposure to air pollution, breathing in secondhand smoke, and working around chemicals and fumes. Also, if you have a history of childhood respiratory infection like asthma, you are prone to develop COPD. Symptoms of this: the biggest symptom of COPD is breathlessness, cough, and progressive dyspnea. And the simple test called a spirometer can be used to measure pulmonary or lung function and detect COPD in anyone with breathing problems. As you can see here, this is what the doctors would prescribe patients with COPD to help them with their breathing. Survival rates. So it was the fourth leading cause of death in 2014, not the third. And COPD mortality in females has more than doubled in the last 20 years. Finally, according to WebMD in 2018, there are several routes to treating COPD, including bronchodilators, oxygen supplement, and in some cases CPAP machines, and we will go over what those are. So the goals around the treatments of someone with COPD is to just relieve the symptoms and slow the decline of the lung functioning and improving overall quality of life, since COPD is in fact progressive and non-reversible. So pulmonary rehabilitation can include any special exercise or activity to strengthen the muscles for breathing in your heart. This can include breathing strategies and education on COPD in general. Various medicines may be used in the treatment of COPD also. Bronchodilators are prescribed for those that usually have chronic bronchitis or asthma. So, of course, someone with COPD would also be prescribed that. And it's a breathable medicine that opens up the airways so you can breathe better. That is a bronchodilator. They last for about 4 to 6 hours and are used as an on-need basis. This is the supplemental oxygen that some people with COPD are prescribed for. The air sacs in your lungs can become damaged or destroyed, and the supplemental oxygen can help relieve some of these symptoms and get airflow into your lungs better. This can include a nasal cannula, which is the face mask that goes around. I'm sure that anyone has seen an elderly person use supplemental oxygen before. And usually this is prescribed to boost your energy for exercise and improves your mood and lowers your overall chance of heart failure. This is a CPAP machine. This is used when someone with COPD is sleeping because it compresses the air and forces it into the body while you are lying down, so the patient is able to breathe more normally. This is the nasal cannula that I was describing earlier, used with the supplemental oxygen for patients. So, prevention of COPD. Quit smoking if you are, because that is the leading risk factor involved with developing COPD. Avoid things like tobacco smoke and other air pollutants if all possible. COPD is one of the leading causes of death and often can be prevented, unlike other diseases. According to Sepsis Alliance in 2018, COPD affects all other parts of your life, including sleeping and exercise. So along with this lifestyle change, you can include breathing exercises 3 to 4 times an hour, exercise, and also get your vaccinations, because pneumonia can often develop into more serious issues like chronic bronchitis. So this is the biopsychosocial aspect of someone that has developed COPD. So as you can see in the biological part, it affects blood pressure. There's a strong genetic component linked with COPD. And on the psychological side, imagine that you have oxygen tank you have to carry around with you everywhere you go just to be able to have dinner with your family or go out in public. And some people are very ashamed of that. And on the social aspect, going to church or even just playing with your grandchildren can often be a hard task because of you not being able to breathe correctly. In conclusion, the one fact that I hope you learned from this is that the prevention of COPD is important. According to Everyday Health in 2018, 85 to 90% of COPD deaths can be prevented by not smoking. Thanks.